someone wrote, "I'm not sure exactly how far we should go when it comes to kids and social distancing uh,
Yeah.
when they're with their friends. Some of my friends and their families are much more relaxed about it than we are. I'm still for keeping the distance and staying outside, but not many people are. Any suggestions that you'd offer?"
Yeah. I mean, I think this is a really tough one. I think it's important to note like what I'm doing. I'm speaking with, from Mystic Valley, and I'm with, you know, I really, I'm being brought on for this webinar, but also I will always lean toward public health and listening to the experts. And so I think holding that while also witnessing the people around us and what becomes normative. And I think there's a concern about what is becoming normative. Is it just, taking the masks and tossing them away? I don't think that's the case, but I think we are trying to say, other kids are getting together, but what about my kids, right? Or what's going on for me? And I think just to check in, the very first thing I usually suggest is just notice what feelings arise for us, which is interesting. I'm not initially giving specific advice, but it's actually just checking in with ourselves. What does that bring up in us to think? Is there a sense of deprivation or loss about what my child doesn't have versus what do they have? And where do I feel that in my body? And just almost noticing that for ourselves, what emotions come up for us around the comparisons. Because those comparisons can get us into a lot of trouble, I think, when we compare ourselves to other people in all sorts of ways. We want to be thoughtful about that. Specifically, some of the public health information talks a lot about being outside is so much more helpful. I believe it's no masks for kids under 2, but older than that, masks are incredibly useful, and just incredibly useful for not passing along COVID. And if play dates can happen, ideally they're outside, where there is enough distance within people to make things happen, to have some connection, but also to not transmit the disease. The other piece that I'm trying to think of what it was, it had to do with some of the advice that I was looking at, especially around Governor Baker's advice and his team, Baker and Polito's advice around what they have for summer camps. They're talking about really trying to contain groups of kids together, especially this is useful for contact tracing. So it's useful for if is a breakout, then how do we track that? But also keeping people together. So some families have gotten together saying, okay, these kids and our families are sticking together, and we know that we're doing our best. And again, it's open conversation. We're doing our best to contain, and we've checked in with the other people who are coming into the home, that everybody is being very mindful about what it means to have social distancing, wear masks, working on contagion issues, et cetera, and really trying to contain it in that way. But again, I want to be very clear and try to stay in my lane. I'm not an MD. I'm not a nurse practitioner. I'm not a nurse. I am a clinical social worker. So that's my expertise.